from a medical family. I have two uncles that are doctors, and I've always been surrounded by a lot of people that had a lot of interest in medicine. So it was a bit of a natural thing for me to think about a career in medicine. I was very fortunate because I was able to do that, and my family supported me through that, and they have been really very open-minded. It does go a little bit against the culture in Greece, where I come from. It's not that easy for a woman to follow a career in medicine, which is a long career, and it doesn't help with having a family. And I did manage to secure a scholarship during my university years from the Erasmus institution to come to the UK for further training, and I think that was really a very proud moment for my family. They saw that all the efforts were really coming into fruition. And then coming in the UK, I found things perhaps a bit easier. I had some support from the Royal College and the Women in Surgery Foundation. Unfortunately, it's difficult to combine doing surgical training and also having a family. You have to move to different hospitals. It's long hours. So I had to postpone that, and I only had started a family in my very late 30s, but it all worked out in the end. I knew from early on that I would like to do surgery because of my personality, I guess. I'm a doer, and I do things with my hands. And then I was looking into various options, and plastic surgery is such a innovative and skillful speciality. I had the opportunity to work at a very well-known hospital in the UK, in Frenchy Hospital, where they have a huge plastic surgery unit. And there were some very inspirational plastic surgeons there doing a lot of cleft lip and palate, and that was really, I think, the turning point where I got to know the breadth of plastic surgery. And also the skills and expertise. It was a challenge, but also gives you so much pleasure when you see the end result. I had a few experiences as a surgical trainee that I don't think were very good. So I did some surgical training in Greece, and quite often I had to behave as a secretary for my professor. It's a very old-fashioned environment. I had to make coffee for the professor, and I have to carry around his things and so on. But I look back on that now with some humor, and I think things have changed and have moved on. But it never really occurred to me to give up. I think mainly because I had support from my family. I think the most rewarding aspect of my work is when I see the patient after the procedure and see the look in their face and see how much, having achieved a result, how much difference it makes to their quality of life. It's something really rewarding, something that makes me feel like continuing to do what I'm doing. Plastic surgery is technically quite challenging. It's always very difficult to try and match the expectations of the patient, and quite often the tissues are not as forgiving as we would like them to be. So there are numerous issues that do not allow us to achieve a good result. So I think you have to be a very good technician first and foremost before you embark on this type of career. I think surgery has been a very male-dominated film area, along with other fields. There are a lot of misconceptions, and I think a lot of women trainees need to be made aware that things have changed, that there are a lot of flexible programs that they can follow if they feel that this is what they want to do. On the other hand, I think it's a bit naive to think that you are going to be a surgeon and you're going to have a lot of free time, and you have to make some compromises. It's not really possible to do surgery and have a lot of time to spend with family and so on. There has to be some balance, of course, but it's a specialty and a training, whichever surgical specialty you do, that takes up a lot of your time. So there has to be some sort of very careful thinking before choosing that. I'm very happy to say that in the UK there is a lot of support for women surgeons through the colleges, but also through various mentors of its speciality. Now we see more and more women that consider this to be a more sort of attractive option for them. I think when a medical student is interested in a career in surgery, they have to first of all decide on a life plan, and second they have to look carefully at the support they can get from family and friends. It's also difficult to get a post for surgical training, which means that your end point may be somewhat delayed. Obviously that doesn't apply only to women, but it's particularly important for women if they plan to have a family after they finish the surgical training, because so you have to really sit down and make a life plan, and then be prepared to work really hard for what you want to achieve. And in particular, in a lot of the cosmetic surgery situations, that is a very valuable tool. Plastic surgery has evolved dramatically over the last few years, mainly through a lot of innovations, technological innovations, also our better understanding of tissues, and the use of microsurgery in a lot of areas. So now our results are a lot more refined than they used to be after the First World War and the Second World War, for example. Also, there are a lot of innovations in the anti-aging arena that help in that area as well. There are some cultural issues when a patient requests cosmetic surgery, and one of these is that they request an all-female team. And that involves the surgeon, the anaesthetist, and also all the members of the team, the surgical team. So I think that's something that we have to respect. It doesn't really mean anything in terms of the skills of the individual surgeon, but obviously it's a cultural issue, and I think, yes, there will always be a demand for that. There are some women that feel that surgical training is too long, and that would impact on their ability to have a family or start a family earlier on. And I think this is a reality. This is the case. So I go back to saying that, yes, you have to make a life plan. Now, obviously, socially things have changed. We tend to see people getting married later on and having children later on. So as long as you're well organized and you know where you're going to have your surgical training and be able to secure the surgical training, because I think this is the most important issue. It is so competitive, so it's really difficult to do that. I don't think the length of it should be a deterrent, because there are quite a few options. Part of it can be flexible training, so that shouldn't be a deterrent. But there has to be some serious thinking before embarking on the training.